Well, currently Tennessee ranks 42nd out of the 50 states in healthcare, the well-being of our citizens. The thing that has been shown to be most effective in improving the health of a state or any community is access to care. We can recruit physicians, we can expand services, but if patients do not have the ability, financial means, to access those services, the health care of the citizens will not improve.
I think we're very representative of rural hospitals around the state of Tennessee, serving a population that's rural. By insuring Tennessee, it helps accelerate and provide access to this kind of care they need.
We are blessed that we are in a hospital triangle between Nashville and Chattanooga and Knoxville, but the hospital being here in McMinnville allows citizens to shorten their drive. It's immediate care.
We have the unique perspective of having hospitals in two McMinnvilles, one in Oregon and one in Tennessee. Oregon has expanded Medicaid, while obviously Tennessee has not. Some of the key things that we've seen differences between the two over the past year have been that our uncompensated care costs have decreased approximately 60% in Oregon at our facility there, while in Tennessee at River Park Hospital in McMinnville, they have increased 3%. I know from firsthand experience with our hospitals in Tennessee, they are more challenged than they ever have been.
We're projected to take care of about 5,000 uninsured patients this year in our hospital, and making sure that things go well, good outcomes, following up with their physician afterwards, regardless. Our goal is to provide care for our community.
River Park Hospital is one of our largest employers here in the county. They employ 340 employees with a payroll of $19.4 million. And that is obviously, the dollar amount is huge, but what that does for our economy here is impressive. If you were to take the $19.4 million away, the county would be devastated. We would be a county that was probably in desperate need of some financial help from the state and federal dollars.
We expect to serve the same patients today, or in the future rather, under expansion that we do today. It's been our experience in states that have expanded. We haven't seen an increase in the number of patients that we serve. It's been more serving patients who now have some level of payment. It may be cents on the dollar, but those few cents on the dollar can make a dramatic difference in the financial viability of a hospital, getting those payments under a Medicaid program versus getting no payments today.
Obviously, they are a taxpayer in the community, and we use those dollars to improve our roads that are coming in. That brings our business and industry and their clients in. We are so blessed to have such a wonderful facility in our community, and being able to take them there and tour that facility and to see what's available in our area means so much to these business people.
Particularly industry. When they look to locate to a community, they look for good school systems and access to health care.
It's been my experience working with economic development and industries, that is what they look for first in communities. It's also been my experience in other states in years past that have lost hospitals, that when the community loses a hospital, it is a major blow to that community from economic development and otherwise.
I think we're a vital cog of the community, not only from an economic standpoint, but from a center point for care.
We need to keep River Park. We need to keep small rural hospitals like River Park afloat. We depend upon them. Without River Park, our community or whatever will have a huge void. Then I'm not sure anything could fill that void.
Those dollars that are being spent here because of River Park Hospital and the employees that they have here and the staff that provides our healthcare system economically could be devastating to a community.
These hospitals, as all community rural hospitals are important to the communities and to the citizens they serve, and it's important that we keep them viable.